Hello and welcome to Symptoms of Listeriosis. My name is David Woodruff. I'm the president of Ed for Nurses, where we empower nurses to become extraordinary. What you're listening to is part of our 2-minute EBP challenge. Every Friday, we send out a question that's evidence-based, and on Monday, you get the evidence-based answer to that question. In addition, you can also watch it here on YouTube. If you'd like to sign up to get this question and answer in your own email, you can go to edfornurses.com and sign up right there on the homepage. In addition, from each of our correct answers each week, we pull out a winner, and a winner wins a prize for a different thing each week. So there's a different prize and kind of makes it a little bit of fun. So if you'd like to join us, go to edfornurses.com. You can sign up right there on the homepage. This week's question was asking about listeriosis. So what is listeriosis? It's infection with the Listeria bacterium, which is a motile gram-positive bacteria. So it's a certain type of bacteria that is often found in contaminated food. Well, where is listeriosis? The current outbreak that started back in August has centered around Colorado in the United States. You notice the states that have the highest concentration are those that are around Colorado. As you start to get out to the outskirts of the United States, there's very few cases. And some of these cases may have been people who were traveling to the center part of the country. So just to give you an idea as to where the majority of these cases have come from. When has it occurred? Well, as you can tell from this diagram here, there was a big peak in the end of August and the beginning to the middle of September. So this started to see some cases here in August, and then we had a big peak here occurring in about the middle of September, and now we're starting to taper off as we move into November. However, keep in mind the incubation period is 1 to 3 weeks with a range of about 3 to 70 days. So in fact, some patients may still present even at this late point in time. Who's at risk for developing listeriosis? Well, patients who have immune deficiency have traditionally in the past accounted for 70% of infections. In this particular outbreak, 84% of patients who ended up developing the infection, and in fact, of those patients who also died, 84% of them were elderly. Pregnant women are at risk, and women in general, especially in this particular outbreak, have been at risk. About 55% of the patients who were involved in this outbreak were women. Okay, now that just may reflect eating habits. That doesn't really mean anything necessarily. It could just reflect eating habits, and maybe women are eating better than men are. Wouldn't surprise me. CDC recommendations, so the Centers for Disease Control have recommended that we avoid eating cut cantaloupe from the Jensen farms. Apparently that's where the outbreak originated. What they say is, hey, when in doubt, throw it out. So if you don't know where this cantaloupe has come from, toss it and don't even bother trying to figure it out, and stay away from cantaloupe for a little while until it all gets sorted out and we make sure. What we've been told is that all the contaminated cantaloupe has been removed from the shelves in supermarkets, etc., so hopefully that won't be a problem. But if you're in doubt, just don't eat it. Let's move on to some other kind of fruit here for the time being. The symptoms of listeriosis infection include fever, muscle aches, vomiting, occasionally diarrhea. So again, you're seeing a lot of stuff that you traditionally see with GI infections. Confusion, seizures can occur if the patient develops meningitis. So the bacterium is in the GI tract that can easily be absorbed into the bloodstream, can circulate throughout the body, cause meningitis, and cause some central nervous system problems. It can also cause the patient to develop sepsis syndrome, leading to septic shock, multi-organ dysfunction, and even death. Keep in mind that the vast majority of patients who are going to end up developing listeriosis are going to be patients who are immune compromised, and therefore fever and an elevated white count may not be really good signs and symptoms to be looking for. And patients who are immune compromised, the inflammatory response is also going to be diminished, which means they'll have less of a fever, they'll have less of an increase in white count. So all of those things are going to be dampened down a little bit, and we may have to be looking for trends, a trending upward in temperature, a trending upward in white count, rather than absolute increases in values. Our treatment is going to be antibiotics. Ampicillin and gentamicin are the two that they usually start with here to treat our patients. Fluids are going to be very important, especially if the patient's had significant vomiting or diarrhea. We may have to do some fluid volume replacement. Keep in mind that IV fluids such as normal saline not only replace the volume that's been lost, but can also replace or help to balance out the acid-base balance in patients who've had significant amounts of vomiting. So normal saline might be a good choice if your patients had significant vomiting. Fever reduction. To try to balance the ventilation perfusion train and try and decrease the amount of oxygen being consumed by the body, it would be important to reduce the patient's fever. Then we don't have to bring as much oxygen to meet the needs of the tissue. This is especially important in patients who are elderly and patients who have multiple other disease processes. Rest is obviously going to be another component as well. He says, let me guess, it's contagious. Okay, well, listeriosis is not necessarily contagious in this manner. We don't need to mask and glove and all that gown and everything else. It's going to be universal precautions. So it's a oral fecal route contamination. So we just want to make sure that you're having good universal precautions and you're going to be okay with dealing with your patient. If you'd like to find out more about the current outbreak, you can go to the Centers for Disease Control. In fact, they have released the information about the current outbreak ahead of schedule or ahead of print by going to the website address at the bottom of the citation here, which is cdc.gov.mmwr PDF week mm60e0930.pdf. Okay, so that you can find the article by going to that website link or by looking up for the article online. Thank you for joining me this week for Symptoms of Listeriosis. My name is David Woodruff. I'm the president of Ed for Nurses, where we empower nurses to become extraordinary. Join us online and find a lot more resources to help you in your quest to become extraordinary. Thanks again for joining me this week. Until next time, bye now.